Having a tick-borne illness of any kind, and Lyme in particular, affects every part of your being. The number one thing is we're in greater Minnesota, and we do have seasons up here, and you can't let your guard down. That's one of the big things. Even in the winter, you still need to keep your guard up, because on those warmer days, the ticks can still be active. So you need to be aware of areas that might be of more concern, where ticks like to be, and what can you do to take precautions. What are you wearing? Are your ankles exposed? Some people tape around their ankles. Keep a lint roller with you. That's very handy when you come out, and you can lint roll, and that can pick up a lot of them, even the small nymph-sized ticks. You can look at using DEET carefully, read the instructions, and permethrin is out there, which is highly effective, but that does not go on your skin. Whenever you've been out, first thing you do is you check for ticks. Behind the ears, all the places, and shower off, scrub off. Make sure that you're treating your pets to prevent them from getting ticks on them. You're probably familiar with the common wood tick. They kind of have that tannish, light gray area, and they're the ones that call a dog tick. They usually don't carry as high a load, but they're still a concern. You'd still want to watch a bite. You want to be more concerned if you're bit by the deer tick, and the deer tick is the one that has the little reddish dot on it. And then the other one that's starting to come into our area is the Lone Star, and that's got a white dot on it. But you want to be particularly careful if you have a deer tick, and especially these little ones. So if you have one on you, it's attached, you can't scrape it off. What you want to do is get a tweezer that has the long end of it. They've got special ones that you can buy for tick removal. I highly recommend it. It's got a prong, and you would put it right between your skin and the head of that tick, and put the tweezer together and lift it off and pull it off. Do not pinch those wood ticks, whatever size they are. Some practitioners recommend that you keep that tick that you've removed, put it in a sealed plastic bag, and put the date on it and identify which kind of tick it is. Because if you would become symptomatic later on, then they could check that tick. Some people feel their immune system in their body reacts right away, and they'll feel like a Mack truck hit them, and they're chilled, and they're fevered, and they're having aches and the pains, and they might get the EM rash, it's called, which is a hallmark for Lyme disease with the Borrelia, and you'll get this kind of bullseye. It can be around the bite size, but it can show up completely other part of your body. There can be more than one pop-out. Thing is, though, only about 20% of the population gets that to help make the diagnosis. For testing, you can check with your local practitioner on how effective their testing is. From my experience, one of the best labs for testing is IGeneX. Getting an earlier diagnosis is going to save you money, maybe your health, if you get that early diagnosis and they know how to treat whatever is going on well. So even resourcing Minnesota Lyme is a great start. Their website has wonderful information on identifying the ticks, prevention, the symptom list is there. And if you've got questions like, where are the doctors that have been trained specifically to understand those nuances and the holistic approach? Because Lyme affects your muscles, it affects your nervous system, your brain, your heart, your endocrine, your hormone system, your gut can get off, and your whole body can be affected. So it's important that you find a doctor that knows. And then there's the LymeDisease.org. That's more of a national one, but they have wonderful articles. They're very up to date on what's going on in Lyme disease today. And no, there isn't a vaccine for this. And again, it's a complicated disease. It's not just one organism. So in our area, I think you have to be vigilant all year round. Know your body and trust your body. Sometimes it's discounted, but you know if your body's off, and just being self-aware. So starting there, and then how to take care of it. And we want to be outside, we want to get that fresh air, and we want to be strong and all that, but take the precautions, keep alert, learn, be well educated on this. It's worth being alert about. You don't want it to spoil the beauty of being in our outdoors, but it's good to be aware so that you can enjoy it for a long time.